Hello everyone, my name is Blake Robles and this is my infogram on alcohol use disorder, also known as AUD. So alcohol use disorder is a chronic relapsing brain disease characterized by an impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences. AUD can range from mild to severe and recovery is possible regardless of severity. So there's three common types of alcohol use disorders. The first that we'll talk about is binge drinking. The second we'll talk about is heavy alcohol use, also known as alcoholism. And the third we'll talk about is underage drinking. So binge drinking, NIAA defines binge drinking as a pattern of drinking that brings blood alcohol concentration levels, BAC, to 0.08. This typically occurs after 4 drinks for women and 5 drinks for men in a 2-hour period. So as you can see from this graph, it once again states that it's 5 or more drinks for men and 4 or more drinks for women. If you see the graph on the right hand side, it says for men that's 15 or more drinks on average per week, or 8 or more drinks on average per week for women would be considered what we would call binge drinking or heavy alcohol use. So the next type of AUD is heavy alcohol use, and the SAMHSA defines heavy alcohol use as binge drinking on 5 or more days in the past month. This is typically seen in a cycle that continues for many months and even sometimes many years. And as you can see from this graph, I like this one as well because it included the fact that any alcohol use by pregnant women is considered too much drinking or a sign of AUD in a pregnant woman because of the fact that it can create fetal alcohol syndrome and also complicate the pregnancy. Also, any use by those under the age of 21 or underage drinking is also considered too much and can be a sign of AUD as well, according to the CDC. So the next AUD we'll talk about is underage drinking. Alcohol use by anyone under the age of 21 in the United States. The legal drinking age is 21 years old. To drink under this age or to sell to persons under this age is punishable by law in the United States. So this graph right here is a little dated, but it also shows that we've seen a steady decline in the amount of younger people that are consuming alcohol in this country. As you can see, about 33.2% of 12th graders consume alcohol, 10th graders is 19.9%, and 8th graders is 7.3%. And as you can see from the graph, those percentages have steadily declined since 1996 till 2016. Unfortunately, I wasn't able to find anything from the National Institute on Drug Abuse that was more current, but I thought that this was pretty cool that we could see the steady decline in alcohol use in our underage people in our country. So let's talk about how common alcohol use is in our country. So this is not only people who suffer from alcohol use disorder, but this is people who just use alcohol in general. So 86.4% of people 18 years of age or older in our country, when interviewed, admitted that they drank alcohol at some point in their life. 56% drank in the past month. 29.9% engaged in binge drinking in the last month, and 7% engaged in heavy alcohol use. I thought these numbers were pretty staggering. I thought that there was a lot of people in our country that chose not to drink at all. And then also the fact that so many people engage in binge drinking is quite shocking to me. But then we can understand why the mortality rate in our country for people using alcohol and driving is so high, because binge drinking is so very dangerous for people to get behind the wheel. So now let's take a look at the global burden of alcohol use. So we can see from these statistics that this is a global epidemic, and this is one of the leading risk factors for premature death globally. some of these numbers here are just staggering to me. 5.9% of all global deaths for men and 4% for women were attributed to alcohol consumption. So doesn't necessarily mean that all of these people had an AUD, but that they died prematurely because of alcohol use in general. Also, some of the numbers that I found staggering were globally, alcohol misuse was the fifth leading risk factor for premature death and disability in 2010. That is just amazing. The fifth leading risk factor. Among people between the ages of 15 and 49, it is the first period in the age group of 20 to 39, and approximately 25% of the total deaths are alcohol attributed. That means 1/4 of the total deaths from the age groups of 20 to 39 years old were attributed to alcohol. That is just amazing to me. So let's talk about treatment for alcohol. So now we know what alcohol use disorders are. We understand that there's different types of alcohol use disorders and that it's very prevalent in our country and also very prevalent globally. So let's take a look at what treatment is available. So as far as treatment is concerned, there's like three basic types of treatment that we have available in this country to treat alcohol use disorder. The first would be behavioral treatments. These treatments are aimed at changing drinking behavior through counseling. They are led by health professionals or substance use disorder counselors, and by studies showing that they can be beneficial. The next treatment for alcohol use disorder that we see most commonly is medications. So there are currently 3 medications approved in the United States to help stop or reduce drinking and prevent relapse. They are prescribed by primary care physician or other healthcare professionals and may be used alone or in combination with counseling. And then the last we have is mutual support groups, also known as self-help groups sometimes. These include Alcoholics Anonymous, AA, and other 12-step programs. So behavioral treatments include cognitive behavioral therapy, motivational enhancement therapy, and marital family counseling. So these are the treatments that we see most often in substance use disorder programs and alcohol use disorder programs. Whether that's a residential or outpatient, these are the therapies that are most commonly used. So as far as medications are concerned, I found 4 medications that are very commonly used. They're they're not all specifically designed to help people quit drinking. Some of them are used as a secondary use for treating drinking. And as you can see on here, that there are only 2 that are specifically designed for drinking cessation, and that would be acamprosate and disulfiram. Are both drugs specifically designed to treat AUD. And as you can see from here, they have some pretty severe effects on the body if you choose to drink while taking these medications. So mutual support groups, there are many mutual support groups out there and self-help groups out there. Not all of them require complete abstinence. Moderation management is also a program out there for mutual support for people who are suffering from AUD that doesn't require total abstinence. But a lot of these programs, to become part of the program and to follow their rules and regulations, it tends to ask for total abstinence. There's also some more mutual support groups here, Smart Recovery and Women for Sobriety, specifically designed for women who are seeking recovery. Then we have some mutual support groups for families of the alcoholic. So these are very important too, specifically because these groups are designed to help the family and the loved ones who are also victims of the alcoholic or person suffering from alcohol use disorder. They're very pivotal in the recovery process, not only for the alcoholic but for the family as well. So alcohol use disorder in the United States. So we know treatment's available. Let's take a look at how many people 18 years or older utilize the actual resources that are available in our country. So 6.2% have alcohol use disorder. Of the 6.2%, this includes 4.2% of women and 9.8% of men. Of that 6.2% who have AUD only 6.7% of those received treatment in the past year. That was just staggering to me, that there are such a high amount of people that are suffering from alcohol use disorder that are not receiving treatment. And I think that if we all had a better understanding of the severity of alcohol use disorder in our country, and if it was something we saw on the news and something that was brought to our attention more prevalently, we would really be able to address this situation. And this is my infogram on alcohol use disorder. Thanks.